Hello everyone, welcome back to my channel. Now today's presentation is about nursing practice questions and answers about gastrointestinal problems of the adult gland. This is part 1. Now let's start with the first question. The nurse is monitoring a client admitted to the hospital with a diagnosis of appendicitis who is scheduled for surgery in 2 hours. The client begins to complain of increased abdominal pain and begins to vomit. On assessment, the nurse notes that the abdomen is distended and bowel sounds are diminished. Which is the most appropriate nursing intervention? So these are the options. Option A, notify the surgeon. Option B, administer the prescribed pain medication. Option C, call and ask the operating room team to perform surgery as soon as possible. Option D, reposition the client and apply a heating pad on the warm setting to the client's abdomen. So the correct answer for this question is option A, notify the surgeon. So on the basis of the signs and symptoms presented in the question, the nurse will suspect peritonitis and notify the surgeon. Administering pain medication is not an appropriate intervention. Heat will never be applied to the abdomen of a client with suspected appendicitis because of the risk of rupture. Scheduling surgical time is not within the scope of nursing practice, although the surgeon probably will perform the surgery earlier than the prescribed time. Question 2. A client admitted to the hospital with a suspected diagnosis of acute pancreatitis is being assessed by the nurse. Which assessment findings will be consistent with acute pancreatitis? So select all that apply. Option A, diarrhea. Option B, black tarry stools. Option C, hyperactive bowel sounds. Option D, gray-blue color at the flank. Option E, abdominal guarding and tenderness. Option F, left upper quadrant pain with radiation to the back. So the correct answer for this question is options D, gray-blue color at the flank, option E, abdominal guarding and tenderness, and option F, left upper quadrant pain with the radiation to the back. Grayish-blue discoloration at the flank is known as Turner sign and occurs as a result of pancreatic enzyme leakage to cutaneous tissue from the peritoneal cavity. The client may demonstrate abdominal guarding and may complain of tenderness with palpation. The pain associated with the acute pancreatitis is often sudden in onset and is located in the epigastric region or left upper quadrant with radiation to the back. The other options are incorrect. Finally, question 3. The nurse is assessing a client who is experiencing an acute episode of cholecystitis. Which of these clinical manifestations support this diagnosis? So select all that apply. Option A, fever. Option B, positive Cullen signs. Option C, complaints of indigestion. Option D, palpable mass in the left upper quadrant. Option E, pain in the upper right quadrant after a fatty meal. Option F, vague lower right quadrant abdominal discomfort. The correct answer for this question is options A, fever, option C, complaints of indigestion, and option E, pain in the upper right quadrant after a fatty meal. During an acute episode, of cholecystitis, the client may complain of severe right upper quadrant pain that radiates to the right scapula or shoulder, or experience epigastric pain after a fatty or high volume meal. Fever and signs of dehydration will also be expected, as well as complaints of indigestion, belching, nausea, and vomiting. Options D and F are incorrect because they are inconsistent with the anatomical location of the gallbladder. Option B, Cullen sign is associated with the pancreatitis.